Hello everyone, this is Sarabjit from Sure Success Nursing Hub. Today we are going to talk about a very important mental health drug, which is lithium carbonate. We hear about it all the time being asked on NCLEX. So lithium carbonate is a mood stabilizer and is used for bipolar affective disorder BPAD, which has mania and depression, both as its components. Adverse reactions are nausea, drowsiness, fatigue, dry mouth, and weight gain, which we assess by measuring the waist circumference and lipids and glucose. It has a narrow therapeutic range, meaning the level at which the drug is effective is very close to the toxic levels. So the therapeutic levels are 0.6 to 1.2 milliequivalents per liter, but the toxicity can be mild, moderate, and severe. Mild starting at 1.5 to 2, moderate 2 to 3, severe more than 3. As an RN, you need to know the signs and symptoms of lithium toxicity so that you can take an appropriate action. What are the signs and symptoms? NCLEX loves to test students on these. Confusion, blurred vision, tinnitus, it's known as ringing in the ears, slurred speech, coma, convulsions, coarse tremors, ataxia, polyuria, and polydipsia are some of the signs and symptoms of toxicity. Now, what puts the patient at the risk of toxicity? Patients who have a recent onset of concurrent febrile illness. Drugs like NSAIDs, non-steroidal anti-inflammatory drugs, ibuprofen, indomethacin, naproxen, Aleve, ACE inhibitors, the drugs ending in prils. So this is a technique to remember. Prils are ACE inhibitors. Remember the suffixes of the drugs to keep them easy. So like captopril, enalapril. Thiazide diuretic like hydrochlorothiazide. The third one is acute ingestion. Sometimes someone takes too much of the drug. Fourth is what puts them at toxicity is impaired renal function. Renal is where the lithium is getting excreted from. Prolonged use of lithium can cause nephrotoxicity and decreased GFR. Altered renal function tests can put the patient at a higher risk. Now, dehydration, very important, or changes in electrolytes. So for example, somebody is playing outside in a hot sunny day and they are sweating a lot. They will be dehydrated and it can lead to lithium toxicity because they're losing the sodium in the sweat. They're losing the electrolytes, so they're at higher risk. Cardiovascular disease. There are some situations where lithium is contraindicated. Pregnancy, breastfeeding. Pregnancy because it can cause congenital malformations. Of course, we just talked about renal failure. If somebody has renal failure, you cannot give them lithium. What are the things you have to teach your patient? First of all is that they should wear an ID bracelet. Second is lithium will get tested every 1 to 2 months, 8 to 12 hours, especially after the drug. People should not be operating the heavy machinery when they are using this drug because it causes drowsiness. Then they should not change the level of salt intake because hyponatremia will lead to lithium toxicity, but hypernatremia will lead to lower lithium levels. Patients should always carry an ID to show that they are taking lithium. And always remember that tell your patients to take the medication regularly and on schedule. There are some important points to remember about lithium. First of all, nephrotoxic. This is the third time I'm talking about it. Renal function tests should be done every 6 to 12 months. Long-term use of lithium can lead to hypothyroidism and hyperparathyroidism. So TSH levels and calcium levels should be checked as a baseline as well as yearly. So these are the most important points about lithium. Please subscribe to our channel. Thank you so much for watching this video, and we will be here with more NCLEX related content. Thank you so much.